Hopefully everyone can hear me well. This is Michael Roy, and I am Senior Vice President at ARGO. ARGO provides business process solutions and innovation out to multiple clients. And as we focus in the healthcare space here, this includes payers, providers, and some of the newest innovations that are coming in the healthcare space, being good partners. But as we brought together a panel today for us in our segment 2 of a series of 3 in webinars. We're pleased to have a great panel here with us. Along with me is our co-host, Louis Nico. Louis is president of the healthcare division of SkyCom. And Louis comes from a background from going back to Accenture Healthcare and others, and bringing some of that thought leadership in the healthcare space, especially when it comes to customer experience. As we introduce the good panel that we have here today, and a couple key questions that we want to focus on, our core objective here is really just for us to be able to bring together some thought leadership, some looks in arrears at 2020 and the challenges that all of us, frankly, had to experience in the course of making business work, caring for our employees, caring for our customers, patients, members in the course of things, and being able to provide a quality of service back despite pandemic challenges, moving into work at home, moving into all kinds of other things, and frankly, a higher demand in the healthcare space at the same time. So lots of great challenges that were there. I think the panel here that we brought together is excellent, being able to share those challenges, some of the opportunities, some of the learnings, frankly, even some of the failures and what had to be recovered from are just as important in what we gleaned from last year. And then the second question that we address is really going to be looking ahead into 2021, and what are some of those key learnings that are being applied here, and frankly, innovating the business as we go forward. So this will have a bit more of a technology spin as we look across people, process, and technology in the healthcare space, and how we improve that patient experience. So that technology focus will be an aspect that we have here today. That said, I'd like to introduce our good panel that we've got, and that includes, and I'll start with ladies first. So we've got Ruth O'Brien, and Ruth is the principal consultant, particularly around a focus of customer experience for NTT, a large global provider of solutions, and we're pleased to have Ruth with us. Additionally, we've got Yossi Abraham, who is president of Zappix. Yossi provides some of the greatest innovations that we're seeing coming out from applications that can help from self-service to other great ways of providing omni-channel experience, being able to meet your patients when, where, and how they want to be met. Further, we've got Mike Puccinelli. Mike is the CEO of SingleCom. SingleCom is one of the great innovative platforms for telephony, omni-channel, being able to manage good workflows, scripting, etc., out there, and is near and dear to the ARGO and SkyCom hearts, as a core provider and platform that we utilize today in the healthcare space. And lastly is Charlie Caperton. Charlie is the Solutions and Business Development VP at Talon. Again, a specialized platform that is bringing great innovation and solutions for healthcare providers in the marketplace today. And I did say lastly, but we've got our own Brandon Badin, who is our head of technology and our Chief Information Services Officer that we have, keeping us all compliant and operational here at ARGO and SkyCom. So glad to have everyone on the panel today. Good. And that said, we will not have any further ado. We'll dive right into the initial question, and Louis will be facilitating questions for us today. So Louis, we'll turn it over to you.
Great, thank you, Mike. Thank you very much for that. So the first question that I have for the panel is, from a technology perspective, what are some of the customer service challenges, failures, successes, and then some learnings from 2020 that you can provide to everyone? And then the first person I'd like to point the question to is Yossi.
Thank you. Thank you for the question, and thank you for having me on the panel. So I think the pandemic really put a spotlight on inefficient practices and outdated technology for several healthcare providers, and really emphasized the need of having technology almost as a necessity in today's time, and really allowing the patients to have that ease of use, digital engagement, and so on. And not everybody had it. And there were some really towering challenges for a lot of those healthcare providers. First of all, they had to handle, from the healthcare's perspective, they had to handle the pandemic and the cases and so on. Second of all, they had to shift a lot of the changes to work from the practice, from the hospital, to move to telemedicine, to move to work from home for a lot of those providers. And I remember even, some of the doctors that we work with, they were talking for years about, oh, we need to start to introduce video calls and video appointments, and suddenly they had to do it overnight. So, and not everybody was ready for that. So I think the challenges were really some technological, some process oriented, and the fact that they had no time to prepare for it, and they had to be really to handle that very, very quickly. And on the other hand, what 2020 has proved to us is really the acceleration of life, I will call it, the acceleration of digital transformation. We have seen it for our healthcare customers. We have seen it across the board. And I think that what we have seen is that those companies that had agility, that had change management mindset, that had the technology in place, maybe not the full technology stack, but had the openness to add layers of technology, they were the ones that were able to adjust as quickly as possible to that to the current situation.
Very good, thank you, Yossi. And I'd like to also pose the same question to Ruth. Ruth, if you can give us your thoughts.
Thanks. You cannot talk about 2020 without talking about the impact that the pandemic had. So building on what Yossi was talking about, one of the things we saw was the rapid move to remote workers, people working at home where they weren't doing that before. And we proved that we're able to not only work at home, but teach our kids at home, right? Get our telemedicine, interact with our healthcare providers, et cetera. And I think what I would say is really both a learning and a success was just the absolute heroic effort that I saw IT leaders and business people participate in to get those folks at home. We had clients that moved over 300 people home in less than a week because they had no choice. And it did accelerate innovation, both in digital, but also just in how we do the work. And I think that's one thing that I take back. And Yossi's right, those that had some kind of a foundational platform were able to do this more successfully. So always having a strategy in place and your foundation strong is going to be important. We partnered with another research organization to do a work at home study with over 4,000 agents and asked them what went well and what didn't go well. And the top 4 reasons what they were disappointed or frustrated about had to do with technology. And that was in the very early days of this. And what happened was organizations had to solve those problems quickly. So collaboration tools, right? VPN, securing the interactions and the internet interactions, et cetera. So those were very important. But the other thing that they told us was once those were solved, what about me as a human? I'm disenfranchised. I don't get to talk to my friends at work anymore. I don't have that social outlet which work provides, but also how do I interact with my supervisor now? How do I get help? And those were the second stage of things that organizations had to solve for. So you have to, Mike talked about the little bit, you have to care for that whole ecosystem. Technology enables it, but all the people and process stuff I think is following quickly behind that. And we're seeing improvements in that. The other thing is the digital world that Yossi mentioned, which is, gosh, people are now willing to self-serve. They're now willing to spend a little time in your IVR to get the help they need. And also, by the way, they want to be able to talk to you anytime, anywhere. They want to book their appointment for their next doctor in the Starbucks line, let's be honest, or while they're driving through because nobody walks into Starbucks that much anymore. So I think that's really the other thing that's driven is how rapidly the technology has accelerated from a digital perspective. So with that, I think the other thing is just how do we deploy those things quickly and successfully, and we have to keep design in mind. If you're going to digitize it or move to a different channel, make sure that experience is to your brand and what the the failures have been people who didn't design well, went out with a new channel and ended up having to pull that back because it didn't generate a good experience. So I think the other thing is thoughtful design goes into the precursor as a proper deployment and a good customer experience and high adoption.
Thank you very much for that, Ruth. And then Charlie, if you could give us your thoughts around this as well.
Yeah, no, thank you again for having me, and appreciate the forum. You know, you couldn't look at 2020 and say that it didn't accelerate a lot of technologies, a lot of processes, a lot of, you know, it's just a tremendously innovative time. Again, don't downplay the situation, but it really forced, you know, I've been in healthcare for 20 plus years, and never seen such rapid change, and rapid change, not just in technology, but in every aspect of, you know, the hospitals, the clinics, you know, just about every space in healthcare. I mean, look, we went into March and April of last year, and you know, we're talking to our hospital clients and clinic clients, and you know, and they're all saying the same thing. You know, our waiting rooms are empty, and what do we do? And you know, everybody had been talking about the idea of, you know, telehealth and virtual visits, remote patient monitoring, all that kind of stuff. And healthcare, as we know, lags other industries in terms of speed to change. But it was amazing to watch how quickly the change did occur. And I think it was important, you know, for us to be able to look at you know, at other alternative, you know, resources. I mean, you know, the speed to which virtual visits went into play, the need for scheduling, all that stuff made us really start to look at how do we outsource and you know, for ourselves and our clients, and you know, and how do we be able to, you know, what's the best way to be able to scale? And so, you know, it was a very interesting time. We had to turn very quickly to, you know, from you know, post-discharge patient follow-up to telehealth and remote patient monitoring. You know, there were needs for our hospital clients, needs for our, you know, our clinic-based clients, and they were pretty much all the same. I would say that it was all in all, it was amazing to me to watch how fast, you know, this all accelerated, and the need for which, you know, to use you know, technology in the beginning, and now technology as we're kind of coming out of the other end, fortunately, of this, and we're looking at, you know, not only, you know, how do we fill up your virtual patient clinic when patients were scared to go in, and rightfully so, and providers were, you know, unable to invite them in, you know, to now on the other side, how do we re-enter the world of healthcare safely? And so, you know, that you know, gave us the opportunity as Talon to really look at how we use our technology as not just a virtual patient clinic or you know, a virtual communication platform, but how do we use the same technology to be able to you know, put up the thermal scanners at the entry and exit points of hospitals, and use our app, the Talon View app, to really to help you know, these hospitals as they reopen.
Yeah.
I was on a webinar the other day, and with a big hospital up in New York, Montefiore, and they were talking about, you know, losing, you know, Delta Airlines levels of money every day, and the big question was, how do we begin to open up safely? And so, really a big transformation on the front end, and now as we're coming out of the back end, and you know, the last thing I'll say is that I think it's not just amazing how quickly everybody reacted, but what a lasting impact this will have. You know, the term Zoom has Googled itself, right? I mean, it's now on everybody's mind, from your grandmother to your, you know, to your youngest kids, and they're learning that way. They're visiting patients that way, or visiting with you know, providers and teachers and everybody. So, what I'm most excited about, I think, is the innovation and the hard work that went in during the pandemic, and the lasting effect that it's going to have on healthcare, and how it propelled us to jump ahead.
Yeah, thank you very much, Charlie. I have to say that I don't think anyone's worked as fast when it comes to tech in 2020 than any other year. I mean, in my 35 years in this business, I've never seen IT move faster, just all around. So I'm going to pose the same question to Mike. Mike, can you share some thoughts on this?
Yes, 2020, as we've all been discussing, was a very challenging year on a lot of fronts. I think the biggest thing that we learned out of that was that we always felt the technology was there. We've been 100% cloud-based for years, as have our partners like ARGO. So from that part, we felt totally safe and secure, as well as competent in that area. The challenge was you had to force a change in behavior to the patient side. And I think what the pandemic did is it finally flipped that equation. And now the patients are more adoptive, if you will, of new technology. And really, they changed the definition of care from our perspective. Because before, you could define care as, I'm going to make a doctor's appointment, I'm going to go into an office. And now it's like, I have elderly parents, but just to get them to be able to use their phone successfully is a challenge. But now that they've learned how to communicate with their provider through video, through text, through chat, and email, they become much more demanding that that's the way they want to be dealt with in the future. So they realize that they don't have to go to the doctor's office to get visits. Now, the challenge is, how do you get the information in front of the person that's providing the care at the time, or addressing the patient successfully, so that they can have a nice, productive conversation. And I think there's a lot of tools out there that people weren't probably that familiar with, that now, because of the pandemic, they've had to adopt some of those technologies that put them more up into the cloud. You don't have to abandon all of your systems. You just have to figure out how to enable them up there, and then also to be able to provide that information and access to the information to the person that's using it. The other thing is, I think from a technologist perspective, we always historically, we've looked at technology, how can we reduce the burden on the human interaction? And I think what we've learned through the pandemic is there's safety in dealing with somebody in a live environment. It's just that mode of communication might have changed. So rather than focus on how do we eliminate a human or eliminate interaction, let's make it really easy for our patients to have access to their information, do what they want to do from a self-service perspective. But when they do want to engage, we need to be able to engage them the way they want to engage us. And we need to be able to chain together all the different types of inputs that we have received, whether it was from an email, a chat session, voice, video, you name whatever mode of communication they use to contact you. You have to be able to chain all of those together and put it in front of the person that is contacting or dealing with a live engagement, so that they can answer somebody without having to have them repeat themselves. So that's a very frustrating customer experience.
Yeah, thank you very much, Mike. And then I want to ask Brandon. Brandon, you're the one that's having to do all these things, right? Things that people are asking for all at the same time, and being able to prioritize things and kind of do things that you probably never thought of doing before. So I wanted to get your perspective on what your life's been so far, and how do you see 2020 affecting tech as it relates to customer service?
Yeah, thanks, Louis. I don't think there's much left to really kind of quote unquote bring up or talk about as far as challenges. I think Yossi, Ruth, Charlie, and Michael really brought that in from the person in the IT that has to make it all happen. If we could think of the old Fast and Furious movie as being the IT, that's really what we were, right? How do we put it all together and be safe while we're doing it? Having to react so quickly and having good partners was really beneficial. I think from our perspective, being in the cloud and having agents at home originally, set us up in a much better position to know what we were going into. Ruth brought up the challenge of moving so many people at home so very quickly. We were very lucky in the fact that we had a dynamic living in the Northeast, right? Having people at home, having a process to get them there. For us, it was really just driving it much faster than we had ever never done before. Having good partners, having the information together like SingleCom, like SkyCom, being able to work together was extremely beneficial. Being able to take those pieces and then apply them and put them together very quickly left us in a little bit better of a position than it did some other people. I think that, you know, as we talk about the technology, as we talk about the customers and the patients, et cetera, being able to move into that position, it was very beneficial to be able to give them, as Michael was mentioning, how do they want that communication to happen, right? And that's really where 2020 began to move forward, was how do we all come together as partners and provide a very holistic approach for the patient and the experience to be able to really move forward. So I think that's really where we were at. Challenge-wise was really just making sure we were doing it correctly, right? We had to move quickly. You know, there was times that maybe we didn't get the test the way that we wanted to, but you know, it was being able to have your eyes on it, working together as partners, and making sure that if something was identified, we were jumping on and you know, fixing it. And it didn't matter whether it was, you know, 2 o'clock in the morning or whether it was, you know, during working hours, right? You had to have your eyes on it, and you had to be there to make sure that we were supporting, you know, those practices and hospitals that were out there.
Good. Very good, Brandon. Thank you very much for that. It kind of leads me into the second question for the panel, which is, of the things that you have developed and the innovation that you were, you know, a big part of, what were the tools, or could be one tool or maybe a couple of tools, that were most impactful to not just the client but to the patient as well, right? If you could share some of that as well.
Sure, absolutely. I don't think in particular there was one particular tool that came out. I think really what happened and what made it beneficial for the patient experience was we all, as individual providers, came together and said, you know what, how can we partner together to work for the practices, to work for the patients, and bring a holistic approach together, right? And that's Yossi coming in and providing some self-service. That's Ruth stepping up and coming forward and partnering with us and saying, hey, let's map that patient journey and see how everything comes together. That's Mike and SingleCom on our back end, providing us with the tools that we need for the contact center. That's Charlie coming in and having the connections with the telehealth to the ERMs and putting everything together. And all of us really working and saying, hey, we're going to put everything that we have together. We're going to give a centralized reporting access. We're going to give a holistic approach, and we're going to give the patient the option of how do they want to communicate with us and how do they want to schedule everything. And I think that's really how 2020 impacted what 2021 is going to look like, and how we're going to be able to provide a better experience, not only for the patient, but also for the practices in communication with the patient and their experience through registering for a new visit all the way through to post care.
Good, excellent. Thanks for that information. Yossi, I want to ask you the same question. On your end, what was the most impactful innovation or tech that you were involved in 2020, leading into 2021, that really was most impactful again for customer service?
I think it is really all about the digital patient engagement and how can we provide that self-service personalization, ease of use for the patients to engage with the healthcare provider. And I would almost characterize it as the consumerization of healthcare. We provide solutions also for other verticals, not only healthcare, and we're actually adopting other processes, other technologies from retail and e-commerce, from insurance, from fintech, and adapting it to the healthcare customers. And when you think about it from that perspective, and then you're really providing them with a user journey, with a digital user journey, with easy to use touch points, and really simple technology that is very useful for them. And for example, I had a conversation with one of our customers last week, and we are currently building a self-service on-demand app for them with timely reminders for before a colonoscopy. It's for a gastroenterology department. So and when they provided us all the information, I told them, you need to think from the end user's point of view. So we also need to guide them to really handle their patients as consumers and we're building currently these on-demand app for them in a way that is very, very easy to use. So, what we're taking from all of this is really looking at the patients as consumers. And it also touches one other point that I think Charlie mentioned before, is that they're also trying to get back to normality. There was, elective services were almost completely stalled during 2020. And this is a major both healthcare issue and a revenue generating issue. And we're helping some of our customers by reminding people, by educating people about the importance of, for example, some of the elective services, whether it's colonoscopy, breast cancer screenings, and so on. So pushing out those reminders, pushing out those educational videos, helping them using self-service to schedule appointments. All of that is part of the back to normality and getting that digital patient engagement.
Great. Thank you very much, Yosef. Yeah, I, being a consumer of healthcare for many, many years myself, I totally understand what you were speaking about as it relates to colonoscopies. I mean, I need to have one every 3 or 4 years. And I understand that patient consumerism started probably somewhere around 7 or 8 years ago. And, due to COVID, it basically went from first gear into fifth gear. So glad to hear your notes on that. Charlie, if you could give us your insights here as far as, if there's one or several innovations that you can speak about that were most impactful for your organization.
Yeah, I think one of the things, look, what happened in 2020 again forced a lot of technology advances that have done unbelievable things for healthcare, for really every industry, but for healthcare in particular. I think one, it really helped us shape our direction as a remote. We've always been a remote care management company, but really, having reinforced the idea that patients are technologically savvy, right? You can Google this, there are more smart devices in this country than there are toothbrushes, right? Mm-hmm. So it's an amazing time that we live in from a technology perspective. So I guess, in hindsight and looking forward, I guess one of the most amazing things is, that the patients are capable of a lot more than we ever gave them credit for. And they're now expecting it. And so, when it comes to telehealth, the remote patient monitoring, using technology in spaces where they didn't before. I mean, our average daily life and outside of healthcare is a lot different than it was inside of healthcare. I mean, we use Uber to get around. We order food with Uber. We watch Netflix on demand. We all this, but somehow we still wait in a waiting room with a clipboard and a piece of paper and a pencil, and we fill out the same information, whether we're in one clinic or another. Those days may be gone. And I think the expectation of efficiency and I think, Yossi, you may have mentioned it, somebody mentioned the consumerism of healthcare. I have a choice now where I'm going to go, and am I going to go somewhere that's efficient? And is it, where I can, do as much online as I possibly can, or am I going to go sit in the waiting room with a clipboard and a piece of paper and a pencil? Well, that's changing. And so, I think, so technology, the ability of the patient, the expectation of the patient has all changed in 2020 and caught up with the rest of your life, right? The Uber and the Netflix and all that has now catching up with healthcare. So I guess, really understanding patients, how they want to communicate, having the ability to have a omni-channel communication platform, and deal with the patient where they want to be dealt with, was big. And so, those were two things. One, the technology and the ability of the patient, and the need for again, safe reentry and opening up not just clinics and hospitals for the purpose of treating patients, but really reopening their revenue cycle, right? I mean, those are things that it's good and great to have great care, but if you can't get the patients back in, so I think, safe reentry is going to be huge. It was amazing to me that our company was able to spin up a COVID-19 contact tracing application along with the hardware at entry and exit points. And quite frankly, I questioned it in the beginning because I thought, wow, isn't this just a temporary situation? And somebody quickly reminded me of the TSA and how that is the new normal, right? Whether it's COVID or the flu or whatever version we have next, we got to be ready for dealing with pandemics or just the flu. So I think those are two big things I got left with over this 2020 thing.
Good. You mentioned an interesting word, and that was expectations. I think there's a level of expectation that really probably didn't really exist before, or it was basically toleration. I think a lot of patients just tolerate it. And we've always seen sort of, the advances in healthcare on the clinical side, but not on the business of healthcare, right? Or which is, anything involved in patient access or patient accounting. So Ruth, if you could give us kind of your, your insights here as far as what was most impactful from a tech customer service perspective.
Yeah, taking a broad look at this from an industry perspective, NTT has been doing a customer experience benchmark study for over 20 years now. And in our latest study in 2020, we asked this question. And the responses that came back from over 1,000 people really were digital, automation, which includes AI, and personalization, right? And in order to do all three of those things, we've got to have the data managed in smart ways, good hygiene, know where it is, how to get to it. And so those were really the key themes. And when you think about that, you also then have to think about that means I'm increasing my channels. Today, most companies are using about 8 channels. That's expected to rise to 11 before the end of this year. Now that means we have even more information, and people have been mentioning connecting those journeys and harmonizing those. That's critical. And that's where we go back to making sure we're designing them correctly. So one of the things that we like to do is just step back and say, hey, what is the customer's journey? We do a lot of journey mapping with our clients. And in doing that, we find out what's working, what's not, where the hot spots are, and where are the opportunities. The other thing is making sure we meet our customers, who they are and where they are. Demographically, what the study also showed us is that people in different age groups want to participate in different channels. This will not surprise anyone. If you're over 55, you still like the phone. Go figure. But there's a whole group of people. And in healthcare, we deal with a lot of folks that are over 55 and 65. Then you've got the millennials who are saying, I don't care if I ever talk to anyone, automate this, please. So when you were talking about expectations, you can't just care for one set of expectations. What journey mapping has taught us, if nothing else, is that you have to care for 4 or 5 different personas or sets of expectations. And I think that's going to be one of the key challenges. Let's think smartly about designing those so we get high adoption when we do innovate. The other is just automation and artificial intelligence. So Gartner predicts, this is their latest study, there will be 23 billion with a B internet connected devices by 2022, which is like right around the corner. So what you're really saying is that's more channels, that's more touch points, that's more innovation. It's going to be required by everyone in this industry and other industries, as Yossi mentioned, because we can learn a lot from others. So that's going to mean is that we've got to get smart about making sure that we can automate and use that. So right now, most people are using rules-based bots, right? I give the bot a set of rules, someone calls in, the bot knows how to push a piece of information out to them or push the workflow along in the back office. But that's changing very rapidly. The bot's going to get smarter. And what we've got to figure out is what do we want the bot to do and how do we make sure the bot still delivers a human experience, which brings us to personalization, right? We want, when we call in, oftentimes the IVR or the bot can say, hello, Yoshi. I see that you have an appointment with us on Tuesday at 10 o'clock. Is that what you're calling about? Yoshi can say yes. Bam, we immediately self-serve Yoshi. Did you want to change that appointment, right? That's smart, and that's being done today. But all the way in through when Yoshi says, no, I have a question about, then it's smart enough to route Yoshi immediately to someone who can help him, the right person with the right skills, that can answer that, whether it's a clinical or non-clinical question. So you begin to see how we immediately impact the customer experiences if we get smart around designing, understanding and designing those experiences, and then begin to personalize them. Every client we talk to in every industry wants to know, how can I make sure that Michael and Yoshi and Brendan get exactly the experience they expect and that they want, and maybe I'm able to even surprise them and delight them with something they didn't expect, because now I can give them next best action. This is what you should be doing with this protocol, and we get the AI smarts behind the bots or whatever we're using, even the humans, to help our clients and customers and patients make better decisions about their care.
Excellent, excellent. Yeah, I wanted to also talk about really quickly. I was talking with my team today on how easy it is for me to go to call my bank through their IVR and get my account balance without speaking to an agent. But we don't have that technology. We still need to have an agent speak to the customer to give them their account balance. And it's almost like, I should be able to do the same. I should be able to, through my IVR system, give the patient the ability to check their account balance. And if they want, let's say, to know what insurance was billed primary and which one was billed secondary, I should be able to do that through the IVR instead of having an agent do that, right? I mean, these are things that we're seeing, within the general world of things, right? When we talk to banks and Amazons and so on and so forth. However, with healthcare, it's not there yet, but could be 2020 COVID could be a blessing in disguise for patient or for consumerism of healthcare. So really interesting your thoughts.
Yeah, and just one other comment on that. What we see with a lot of healthcare organizations, especially the more sophisticated ones, is they're pulling all that data together to do exactly what we're talking about. So they have to get the electronic health records harmonized with whatever patient experience, other technology they have, their billing systems, right? Or their scheduling systems. All those are living in silos right now. If we can just pull all that together and connect it, now we've got something we can really work with. So we can give the answer to the question about which was billed primary and secondary, or was it, how do I solve a, we know billing questions are a high driver of calls into the facilities as well. So we can get smart about that.
Yeah, those two questions that I posted about account balance and what insurance was billed in my account are the two top call dispositions that that I'm seeing right now. Great. So I think we've got some poll questions for everyone, and I wanted to pivot over to Mike. Mike, you've got access to those poll questions, and if you could do us a favor and share the poll questions with the group.
Absolutely. As a matter of fact, during the course of Lewis, while you're facilitating otherwise, Tricia was good enough to push out those questions to our participants and being able to run that together. So the first poll question that we shared out, especially looking in arrears at 2020, was what do you find most demanding, challenging to manage through 2020? And it could have been a stack rank or select. And it was, determining whether it was conversion from working in center to work at home, compliancy, and being able to meet that through the course of all these changes in heavy demands, platforms, telephony, learning not ready, learning systems not ready or suitable for work at home environments. And the last one was workflows and processes that needed to be redeveloped in order to be to meet the demands as well as the compliancy that are essential. So it'll be interesting to see what we've got coming back from that. Tricia, I'll invite if this is something that we'll be sending out just in follow-up, or whether we do have kind of a stack ranking of what we've gotten back to date.
Yeah, so I can pull up and share what those results look like. We still have the second question up. In a couple of minutes if folks want to respond to that one before I pivot over to response to the first. Good.
Why don't I'll go ahead and just cover the second then, and then we can show the results from each. And Perfect. Then we did have a question come in on Q&A as well, and I want to make sure that we've got an opportunity to be able to get to that as well. So the second poll question that we had, which is looking into 2021, are what are the top customer experience technology and innovation developments that may be most impactful to healthcare CX in 2021? Now, it's a broad question, but we at least gave 4 areas to be able to select highest priority. And the first one was more adaptable and comprehensive platforms for patient communication. We've got some good experience on this panel with that today. Need for update to core EHR, and we know many of our clients today are wrestling with that as a critical one. The third is displacing old redundant architecture and simplified cloud-based solutions. And the fourth is leveraging contact center and technology partners for expertise and resources. And I think that fourth one comes back to a core theme that's been echoing, I think, from a lot of our participants and a lot of the folks on the panel, is that there isn't a need to go it alone. So being able to select that, and we invite our participants to be able to make a selection at this time, and then we'll be able to share back what those net results were. And then Tricia, as you have a chance to tabulate that, I'll go ahead and invite the panel, and Charlie, I'm going to go ahead and ask you to kick this one off. Cynthia Zanikova sent over a question for us, and she actually rephrased it a little bit, stating, I'm wanting to know how provider adoption is helping to drive acceptance of patient utilization for telehealth platforms. So she took it into a much more concise area. And Charlie, I know with your platform specialized in this area, maybe you can kind of kick off a little bit of a response there.
Yeah, that's a great question, Cynthia. And the reality was, again, not to go back, and rehash the fact that the rest of our lives in general, outside of healthcare, have been pretty advanced. I mean, again, hey Siri, what's the weather going to be like today? Or gosh, it's listening to me, or Amazon listening device, what's the weather going to be like today? What's grabbing an Uber to work, or ordering food to be taken out. I think a lot of our life was driven by the experience and the ease of experience. And again, when it came to healthcare, and telehealth and remote patient monitoring, virtual visits, when it comes to healthcare, we rely so heavily on the suggestion of our provider, doctor, nurse, whoever it is. We put a different, or at least my experience is a different emphasis is put on their reaction, their suggestion, than in any other aspect of our life. Because if the doctor says, take this, you're going to take that. If the doctor says, go get this test, you're going to take that test, and so to Cynthia's question, it was need, I think, that pushed the provider to really push telehealth and remote patient monitoring and virtual visits. So, they opened their door, they looked out and they said, boy, our waiting room's empty. What are we going to do? And we were seeing patients every 15 minutes all day long, and now those patients can't come in and won't come in. And so there was a need very quickly to shift to telehealth, remote patient monitoring, to stay alive and to keep the doors open. So it was that need that drove the providers to drive the patients. And so I think that we saw, the tremendous adoption rates. I know with our platform, we've really built sort of a virtual patient clinic, right? So it's not just telehealth or virtual visits, or it's the ability to monitor devices. Ruth, to your point, the number of devices that we're adding to our hub, if you will, is growing every day. I mean, we just met with a company called Stratus Labs. They've built a wearable device that listens to your lungs and connects via Bluetooth back to our platform. So patients with COPD that are having distress long in advance, and it uses a lot of AI to process that data, to say, hey, this patient is going down a path of distress. And we know with COPD patients, their likelihood to readmit to a hospital is high. Same with, CHF, congestive heart failure, or diabetes, sepsis. A lot of these top conditions have really worked together to with technology and data and AI to help drive what both the providers are doing and what the patients are doing. You've got companies like CardioMEMS and all these great high tech companies that are creating wearable devices that are able to monitor patients on a real time basis. And so I think that the need for the provider to get to advance their thought around remote patient monitoring, remote care management really has driven the patient's compliance. And again, if the doctor says do it, there's a high likelihood that the patient's going to do it. And if the doctors now need to do it, and it's really helping drive the patient to do it. So it was 2020 did a lot of things, but I think when it came to patient adoption to virtual visits to telehealth, that may have been driven partially by patient need, but a lot by provider. They needed, CMS, the Medicare, Medicaid, the federal government really changed the rules when it came to remote patient care. They said, hey, look, we know patients can't come in. So instead of billing a 99213 office visit CPT code, let's add a telehealth modifier and do that from home, because we still need to get our eyes on the patient. We still need to see it. And again, another quick way that the federal government responded in saying, hey, we're going to pay for these visits, even if they're from home. And so there were a lot of things that really went into driving this, but at the core, it was, it is, to Cynthia's question and comment, it was the provider and a need all the way around.
Yeah, Charlie, I appreciate that response, and frankly, I appreciate Cynthia's note that the provider had been part of the holdback prior, and so much of that goes to the compliancy in some degrees, and some of it was driven state by state, right? And some of it was comfort in being able to for the providers that have been operating within a certain paradigm and compliancy to be comfortable to move into new technology and new forms and new communication, and not to have that training. AMA just released some new stuff about the necessity and the process that's being pushed now for providers to be trained to adopt the technology. Essential for telehealth, essential for remote patient monitoring, right? And the coaching that comes along with that. These are some of the things from the people, process, technology that all of us collectively on this panel have been putting together as solutions and implementing into market. But it's no longer just that the technology exists. It's the necessity of this past year that really pushed that forward. And I think seeing that and the coming down of some of those regulatory walls state by state. Now north of 40 states have changed their regulatory and compliance. CMS led the way in a lot of the things a year ago. So really being able to see some of those things come about. The next is going to be now how do traditional med schools begin to help train that next set of clinicians that are coming forward to be comfortable with technology and how that's going to apply well. And I think that's going to be a next step in the evolution of where we go here. So
but it's also
back from the panel, any other comments on that question, Yossi?
Yeah, I want to say that it's on the provider side, but it's also the acceptance of the patients to absorb and to utilize all of these new digital solutions. And it's not only by the millennials, it's also by the older population. And we're providing, for example, a digital survey after appointments, with the doctors and the other healthcare providers. And we see that 42% of the responses are actually coming from people that are 61 years and older. 42% of the responses are coming from that age group. And actually 68% are coming from 50 years and above. So it's not only this older population that we were all afraid of providing those digital solutions. are actually using it much more and have accelerated the usage of the digital platforms during the last year.
Struggling with my mute button there. Yeah, great point there, Yossi. And that adoption now all the way around and how that's moving. So as we look through 2021, I think it's going to be a bellwether year, frankly, from how regulatory applies, and as regulatory has been forced now to make changes, how providers have been forced now in order to be able to meet the healthcare demand. And then to your point, Yossi, is frankly, as the consumers of healthcare, across the board, we're not just seeing it in younger generations that are tech savvy, but frankly, across the board, as we get older, we become greater consumers, and being able to recognize that other industries, whether it's our entertainment, whether it's our banking, and financial accesses, that older consumers, frankly, have been trained and adopted in other things. So it's not going to be a trade-off of a lot of this experience. It's going to be more when, where, and how these consumers of healthcare want to be met, and with regulatory having to adapt to some of that. So, any other comments there? All right, I'm going to invite Tricia, if we've got some net results that we might be able to share across from some of our panelists on our poll questions. Let's go ahead and put that out there. Okay, and the first one is, what did you find was most demanding, challenging, looking at arrears at 2020? The top result was the conversion from work in center to work at home, and not a surprise there so much that you're talking about changing over of workforce and location and technology and being able to meet that compliancy, on the next as being a key area of 31%. While lower compliancy was still one of those critical factors that compliancy didn't go away. There might have been a little laxing of rules right down to docs doing Zoom calls like we're doing right now, right before becoming fully compliant back on platforms. But at the same time, compliancy didn't go away, and so being able to adapt to that. The high performer here was clearly the platform's telephony and learning systems not ready or suitable for work at home environments, and so that adoption alone, and a lot of our panelists here being able to accommodate with those platforms in that good knowledge base that needs to come in there were essential. That one's not over yet. But the technology exists there, and really now it's going to be, having those hard conversations, budgets, et cetera, to be able to get over there. But I think also the way that a lot of cost models exist today, we're not talking about forklift changeouts of platforms in order to be able to get there. Cloud-based platforms that are very adaptable with price models that are very affordable to be able to come into the mix, make an awful lot of sense. It's having those conversations with both operations and IT within provider environments now to be able to make those changes over. And then lastly was workflows and processes need to be redeveloped. And while it came in lower along the way, perhaps as a priority, we all know that we've all lived that in being able to make sure that those workflows reflect that. Mike Puccinelli, I know your engine that you have driving right in that space has been critical in order to be able to make a lot of those accommodations. So, any comments from the panel? Any surprises?
Yeah, Mike, I also want to add that also redundancy has become something that is, at least from my end, I'm seeing a lot more discussion around redundancy, and what I'm referring to is, geographic redundancy, whereas a work from home environment sort of, for lack of a better word, makes it a little bit easier to create, redundancy models, right? When you have people that are working from home as opposed to folks working in one center. That's something that I just wanted to share with the rest of the group to see if maybe, they're having similar discussions or something like that.
Well, certainly, I know that collectively we've seen a lot more requests come out, from client set in the healthcare space specifically around, hey, my own internal center is down. We can't come in, how can you help, right? And looking to outsource services providers, which we all represent in various forms, people, process, and technology, how can we help, right? So having partners in that space really has become an essential request, and better technology that might be more cloud-based and routable and playable in a much more rapid sense is certainly there, right?
Absolutely.
Good. Yeah.
It's all about business. Yeah, it's all about business continuity. So.
Good. And Trisha's put up our next one there, which is our question 2, looking at 2021. What are some of the top customer experience technologies and innovations that we think will be most helpful or impactful in the healthcare space? So it's funny, the first 2 really did not get much response at all. Between the adaptability of comprehensive platforms or the need for a core EHR upgrade, really all of the answers really fell into the second set, which is displacing old redundant architecture with simplified cloud-based solutions. If anybody's interested, I know a few folks on this panel might be happy to talk to you. The second is really leveraging contact center and technology partners for expertise and resource. And again, coming back to that theme of, there's no good reason to go it alone anymore. Having that good expertise to bring a broader perspective, to bring best practices to mind, to bring some of that redundancy that we were just talking about into the mix, makes great sense for building those things in this year if they hadn't been built in prior. So I'll invite again comments from the panel.
I've got something. So one thing that was interesting on the 2 poll questions, I think, at ARGO and SingleCom, we take for granted the architecture being up in the cloud, and ours is about as simple as it gets. But I think Ruth hit it spot on. There's going to be all these inputs from every different type of device you can imagine. A lot of people have a wearable that they wear now. If they don't, they'll be getting one. Everybody has a cell phone. But it's how you connect all of the disparate pieces of information together and either have proactive or some kind of outreach communication to a patient that's really going to set people apart as we go forward. So I was shocked on the first poll to see that workflows were not a bigger vote getter, because it seems to me that that's the biggest. I feel like everybody's going to be up in the cloud sooner rather than later, but it's how you use that information and how you address both incoming inquiries or outgoing proactive outreach, and use that information to provide some value to the patient without them having to reach out to you. That's going to set people apart. So I think workflows are going to be something that is going to be a big driver going forward for satisfying customers.
Yeah, the other thing I would add is, and I mentioned our benchmark study, and the other thing that when people said what gets in the way of moving your technology and innovation forward, it's lack of resources that are skilled to do that. Most healthcare organizations don't have a data scientist on staff, right, to help you with what you're talking about, pulling all that data together. And most don't have a user interface designer on staff. So I think this is where you can find partners who have that particular skill and surgically insert them to solve that problem, get the design and the harmonization of the data. And then what you're talking about, Michael, is then you can connect those channels, pull all that data and make smart decisions, so it's predictive. We want to get to the point of being predictive about what can and should happen next, and that pulls the customer through that experience in a significantly better way, I think.
Excellent point.
Yeah,
I
well
think that's
stated. And I'm sorry, was there another comment?
No, I think I was just going to agree with both Mike and Ruth on that point, where in 2020, we saw, everybody having those challenges with their systems, with their telephony, with their platforms, because they weren't prepared to head into, the at-home kind of virtual environment, right? So now that we're there, to Ruth's point, now in Mike's point, we're going to start to see those workflows and become more adaptive and how they all come together. And I think it just kind of brings back to the point where, I think we've all hit on it, right? That don't go it alone, right? We're all here and we all partner together to provide that holistic approach and give everybody the workflows and experiences that they want heading into 2021 and beyond.
No, great note, Brandon. Thanks for the contribution. I think for all of us now, as we're rolling into the final minute here, is just recognizing that as we look at healthcare in 2021, we were pushed forward significantly last year. So much of this technology pre-existed, but there hadn't been the impetus or the force or the kick right up to regulatory that may have been restricting much of that as well. We were forced into this, but it's an area that other industries have gone ahead. So now being able to take some of those best practices that have existed where the consumerization of healthcare, we as consumers are more ready for this in that adoption. So as providers or as healthcare payers out there in a lot of our participants and audience as well are looking at things, it's a brave new world, but it's not one that healthcare is venturing into without some precursors going ahead from other industries. So we've got technology that exists from much of this panel as well. We've got data scientists that exist and are ready to jump in and help and are already doing so in so many regards, so that we can do things better, smarter, meeting our consumer demand when, where, and how they want to be met, and helping a lot of these providers adopt over more quickly. And how can we simplify their architecture in order to be able to do so? So I think this has been a great panel for us to bring this forward. We do have another series coming up next month, also on the 24th, as we tie together again people, process, and technology. So we invite our participants, to come join us then. And we want to thank this great panel, from Ruth, Yossi, Charlie, Mike, Brandon, Louis. Thank you for helping us co-host today. But wonderful discussion, and thanks very much for everyone for participating.
Thank you.
Thank you.
Thank you very much.
Thanks, everyone.
Thanks to our participants as well. Bye now.
Bye.